Good morning, everyone. Today I will be presenting on HIV transmission prevention. Before I begin my presentation, I would like to take a moment to recognize that this can be a sensitive topic. Despite the topic's sensitivity, I believe that we, as safety professionals working for the SHA, must be able to openly talk about this topic so that we can work together to reduce and prevent its transmission among staff and patients. This presentation will cover the following: what HIV is, how HIV is spread within the healthcare setting, why transmission prevention is important, and the methods that can be used to reduce and prevent the transmission of HIV within the healthcare setting. HIV is a virus that attacks a person's immune system. This weakens the body's defense against infections and some types of cancers. Once contracted, HIV will progress through 3 stages, including the acute HIV infection stage, the chronic HIV infection stage, and the acquired immunodeficiency syndrome stage. As the virus progresses, the symptoms and the effects that the virus has on a person will continue to worsen and compromise their quality of life. Saskatchewan is continuously facing the highest HIV diagnosis numbers throughout the country. Without transmission prevention measures in place, more people will be more prone to contract the virus and face lifelong challenges without and with proper medical treatment. For example, healthcare workers who are injured from a needle stick injury have around a 1% chance of contracting HIV. Now, this may not seem like a big percentage, but for approximately 1 in every 100 healthcare workers who are poked by a contaminated needle, they will receive a lifelong illness. If we take that percentage into consideration, along with all the other ways a worker could contract HIV, the numbers begin to quickly add up, and we can begin to see the magnitude of this issue. HIV is mainly spread through body fluids, including blood, semen, discharge, and breast milk. The HIV in these fluids must get into the bloodstream of an HIV negative person. Healthcare workers, such as nurses, CCAs, doctors, housekeepers, and lab technicians, are at a higher than normal risk for exposure due to working in their line of work. These workers are likely to be exposed to bite wounds, scratches, needle pokes, blood, and more. The main methods used to reduce and prevent the transmission of HIV include PPE, hand hygiene, safe needle handling and disposal techniques, the use of sharp containers, and education and training. For the remainder of this presentation, I will be talking about the methods to help reduce transmission. Depending on the anticipated exposure, workers must wear and have the following PPE readily available: gloves, gowns, masks, and eye protection. Wearing PPE will help prevent against absorption, inhalation, and ingestion of body fluids. Workers must follow safe hand hygiene procedures to reduce the likelihood of transmission. Safe hand hygiene procedures include avoiding unnecessary touching of surfaces near patients, washing your hands with antimicrobial soap and water when your hands are visibly dirty, contaminated, or soiled with blood or bodily fluids. If your hands are not visibly soiled or after washing your hands with soap, decontaminate your hands with an alcohol-based hand sanitizer. Not wearing artificial fingernails, and performing proper hand hygiene techniques as specified under the SHA hand hygiene policy. When working with sharps, workers should do the following. Keep the sharp object covered or wrapped until it is time to use it. Keep the sharp object pointed away from themselves and others. Never recap or bend a sharp object. Keep their fingers away from the tip of the sharp object. Never hand a sharp object to someone or put it on a tray for another person to pick up. And tell other people they are working with when you plan to set the object down or pick it up. A worker should always be in control of the sharp object they are using. When disposing of needles, workers should take the following precautions. Ensure the disposal container is made for disposing of sharp objects. Replace containers or alert a supervisor when disposal containers are 2/3 full, and never put their fingers into a disposal container. If a worker finds a needle outside of a disposal container, it is safe to pick up only if you can grasp the non-sharp end. If you cannot, tongs should be used to pick it up and dispose of it. Some additional suggestions for sharp disposal containers include having marked disposal containers in easily accessible areas for staff to promote use and to prevent needles from being improperly disposed of, training workers in the location of disposal containers and how to properly dispose needles into them. This includes workers such as maintenance people, housekeepers, cooks, and etc. And also by having all containers at eye level and within the reach of workers. To reduce and prevent the transmission of HIV within the workplace, all workers should be educated on what HIV is and how it is transmitted, transmission prevention methods, hand hygiene policies and procedures, and company reporting protocols for needle stick injuries and suspected transmissions. Workers must know what to do if they have been poked by a needle or if they suspect they have been exposed to HIV. All workers should be trained on donning and doffing procedures for PPE and also how to safely dispose of needles. This training should be reviewed regularly to ensure that their education remains up to date and they know what to do at all times. In conclusion, HIV is a lifelong illness, but its transmission is preventable if we take the proper measures to help reduce and prevent staff and patient exposure. Because the diagnosis rates continue to be on the rise in Saskatchewan, we must openly discuss the issue and create solutions to reduce the rates within our province. PPE, hand hygiene, needle handling and disposal techniques, sharp containers, and education and training are just the beginning of what we, as safety professionals, can do for our staff and our community to reduce and prevent the transmission of HIV. These are the references that I consulted to build my presentation. If you would like more information on the topic, please let me know and I can forward you on these links. Thank you.